Hey Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is NCLEX PN Review Lesson 20. We're going to be doing musculoskeletal medication questions. You can follow me on Facebook, Instagram, and TikTok to get any updates. Links will be in the description. Without the way, let's get started.
Question 1. The client has been on treatment for rheumatoid arthritis for 3 weeks. During the administration of etanercept, it is most important for the nurse to collect which data? A. The injection site for itching and edema. B. The white blood cell counts and platelet counts. C. A metallic taste in the mouth with a loss of appetite. D. Whether the client is experiencing fatigue and joint pain. The correct answer is B. The white blood cell counts and platelet counts. Rationale, infection, and suppression can occur as a result of etanercept. Laboratory studies are performed before and during medication treatment. The appearance of abnormal white blood cell counts and abnormal platelet counts can alert the nurse to a potentially life-threatening infection or potential bleeding. Injection site itching and edema are common occurrences following administration. A metallic taste and loss of appetite are not associated with this medication. Fatigue and joint pain occur with rheumatoid arthritis. Question 2. Alendronate is prescribed for a client with osteoporosis, and the nurse is providing instructions on administration of the medication. Which instruction should the nurse reinforce? A. Take the medication at bedtime. B. Take the medication in the morning with breakfast. C. Lie down for 30 minutes after taking the medication. D. Take the medication with a full glass of water after rising in the morning. The correct answer is D. Take the medication with a full glass of water after rising in the morning. Rationale, precautions need to be taken with the administration of alendronate to prevent gastrointestinal side/adverse effects and to increase absorption of the medication. The medication needs to be taken with a full glass of water after rising in the morning. The client should not eat or drink anything for 30 minutes following administration and should not lie down after taking the medication. Question 3. The nurse is monitoring a client receiving Baclofen for side effects related to the medication, which should indicate that the client is experiencing a side effect. A. Polyuria. B. Diarrhea. C. Drowsiness. D. Muscular excitability. The correct answer is C. Drowsiness. Rationale, Baclofen is a central nervous system depressant and frequently causes drowsiness, dizziness, weakness, and fatigue. It can also cause nausea, constipation, and urinary retention. Clients should be warned about the possible reactions. Options A, B, and D are not side effects. Question 4. In monitoring a client's response to disease-modifying anti-rheumatic drugs, which findings should the nurse interpret as acceptable responses? Select all that apply. A. Symptom control during periods of emotional stress. B. Normal white blood cell, platelet, and neutrophil counts. C. Radiological findings that show non-progression of joint degeneration. D. An increased range of motion in the affected joints 3 months into therapy. E. Inflammation and irritation at the injection site 3 days after injection is given. F. A low-grade temperature upon rising in the morning that remains throughout the day. The correct answers are A. Symptom control during periods of emotional stress, B. Normal white blood cell, platelet, and neutrophil counts, C. Radiological findings that show non-progression of joint degeneration, and D. An increased range of motion in the affected joints 3 months into therapy. Rationale, because emotional stress frequently exacerbates the symptoms of rheumatoid arthritis, the absence of symptoms is a positive finding. Disease-modifying anti-rheumatic drugs are given to slow progression of joint degeneration. In addition, the improvement in the range of motion after 3 months of therapy with normal blood work is a positive finding. Temperature elevation and inflammation and irritation at the medication injection site could indicate signs of infection. Question 5. A client with acute muscle spasms has been taking Baclofen. The client calls the clinic nurse because of continuous feelings of weakness and fatigue and asks the nurse about discontinuing the medication. The nurse should make which appropriate response to the client? A. You should never stop the medication. B. It is best that you taper the dose if you intend to stop the medication. C. It is okay to stop the medication if you think that you can tolerate the muscle spasms. D. Weakness and fatigue commonly occur and will diminish with continued medication use. The correct answer is D. Weakness and fatigue commonly occur and will diminish with continued medication use. Rationale: the client should be instructed that symptoms such as drowsiness, weakness, and fatigue are more intense in the early phase of therapy and diminish with continued medication use. The client should be instructed never to withdraw or stop the medication abruptly, because abrupt withdrawal can cause visual hallucinations, paranoid ideation, and seizures. It is best for the nurse to inform the client that these symptoms will subside and encourage the client to continue the use of the medication. Question 6. The nurse is reviewing the laboratory studies on a client receiving Dantrolene sodium. Which laboratory test would identify an adverse effect associated with the administration of this medication? A. Creatinine. B. Liver function tests. C. Blood urea nitrogen. D. Hematological function tests. The correct answer is B. Liver function tests. Rationale: dose-related liver damage is the most serious adverse effect of Dantrolene. To reduce the risk of liver damage, liver function tests should be performed before treatment and periodically throughout the treatment course. It is administered in the lowest effective dosage for the shortest time necessary. Options A and C are tests that assess kidney function. Question 7. The nurse is reviewing the record of a client who has been prescribed Baclofen. Which disorder should alert the nurse to contact the healthcare provider? A. Seizure disorders. B. Hyperthyroidism. C. Diabetes mellitus. D. Coronary artery disease. The correct answer is A. Seizure disorders. Rationale: clients with seizure disorders may have a lowered seizure threshold when Baclofen is administered. Concurrent therapy may require an increase in the anticonvulsive medication. The disorders in options B, C, and D are not a concern when the client is taking Baclofen. Question 8. Cyclobenzaprine is prescribed for a client to treat muscle spasms, and the nurse is reviewing the client's record. Which disorder would indicate a need to contact the healthcare provider regarding the administration of this medication? A. Glaucoma. B. Emphysema. C. Hyperthyroidism. D. Diabetes mellitus. The correct answer is A. Glaucoma. Rationale: because this medication has anticholinergic effects, it should be used with caution in clients with a history of urinary retention, angle closure glaucoma, and increased intraocular pressure. Cyclobenzaprine hydrochloride should be used only for short-term, such as a 2 to 3 weeks therapy. The disorders in options B, C, and D are not a concern when the client is taking cyclobenzaprine. Question 9. Dantrolene sodium is prescribed for a client experiencing flexor spasms, and the client asks the nurse about the action of the medication. The nurse responds knowing that, which is the therapeutic action of this medication? A. Depresses spinal reflexes. B. Acts directly on the skeletal muscle to relieve spasticity. C. Acts within the spinal cord to suppress hyperactive reflexes. D. Acts on the central nervous system to suppress spasms. The correct answer is B. Acts directly on the skeletal muscle to relieve spasticity. Rationale: Dantrolene acts directly on skeletal muscle to relieve muscle spasticity. The primary action is the suppression of calcium release from the sarcoplasmic reticulum. This in turn decreases the ability of the skeletal muscle to contract. Options A, C, and D are not actions of the medication. Question 10. The nurse is reinforcing discharge instructions to a client receiving Baclofen. Which should the nurse include in the instructions? A. Restrict fluid intake. B. Avoid the use of alcohol. C. Stop the medication if diarrhea occurs. D. Notify the healthcare provider if fatigue occurs. The correct answer is B. Avoid the use of alcohol. Rationale: Baclofen is a central nervous system depressant. The client should be cautioned against the use of alcohol and other central nervous system depressants because Baclofen potentiates the depressant activity of these agents. It is not necessary to restrict fluids, but the client should be warned that urinary retention can occur. Constipation rather than diarrhea is an adverse effect of Baclofen. Fatigue is related to a CNS effect that is most intense during the early phase of therapy and diminishes with continued medication use. It is not necessary that the client notify the healthcare provider if fatigue occurs.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.